Good afternoon. You're tuning into the Health and Wellness Hour right here on the People Station with your favorite gerontologist, Dr. Macie Smith. This show is sponsored by MUSC Health Orangeburg. Speaking of MUSC Health Orangeburg, joining us today is the new CEO of MUSC Health Orangeburg, Mr. Walter Bennett III. Welcome, Mr. Walter Bennett III. Thank you for being here.
Thank you for having me.
Wonderful. First, I want to say thank you for your partnership with WOCS 93.7 and getting really good information, health information, and support information to our rural community. Now, you're new here.
Yes.
Now, how long have you been here?
As of yesterday, 6 months.
6 months. So you've been here. So you are new. You are brand new.
Brand new.
To MUSC Health Orangeburg. Now, when you arrived here in Orangeburg, was it MUSC Health Orangeburg at that time?
It was MUSC Health Orangeburg. I came in June, and MUSC was acquired, TRMC, formerly, was acquired back in March.
Okay.
Yes.
So what was your first order of business? I'm excited to hear about your first order of business because it is no secret that the former hospital did not have a good reputation in our community, which is sad because we don't want our folks driving 30, 40, 50 minutes for health care. So I'm curious to know what your first order of business was.
So when I came in, and I always tell the story of my first day here in Orangeburg, I was in orientation, and they were going around telling their name and what department they're going to. And then they got to this one young lady, and she was like, "Hey guys, do you know what they call TRMC?" And I was like, "No, what do they call TRMC?" Because I'm thinking the Regional Medical Center.
Right,
Because
that's
that's
right.
what it was. She was like, "Turn right and make it to Columbia or Charleston."
No. Oh my God.
Yeah, that was kind of a shocker for me. And then I was the last person to come up to say, "Hi, my name is Walter Bennett III. I'm the new CEO here." And she was like, "Oh my gosh, I can't believe I actually said that." And I was like, "No, we need to hear things like that because that is not the perception that we want MUSC Health Orangeburg moving forward with. We want to find ways of how do we keep our patients close to home. And that's been the theme since I've been here. How can I keep our patients close to home here?"
So that comment was very jarring for me. Being from here, my entire family is here. They still drive because they say they're not elderly, but they are. But they still drive. But the fact that they would even consider driving to Columbia is a barrier for them. And I'm thinking about the folks who are in the other parts of the county who don't have public transportation.
Exactly.
What has been some of the challenges so far?
So what I've learned here since I've been in Orangeburg, transportation is a major issue with our patients and in our community as a whole. So again, looking at how can we create better access for our community here in Orangeburg, whether it's if they're able to come to the hospital, that's great because we're going to offer a great experience for them when they come to the hospital. But how do we engage in telemedicine? From an access standpoint, but we're also looking at from a patient care standpoint with our primary care physicians. Are they in the right locations to meet the needs and the demands of our community here in Orangeburg, Calhoun County, and Bamberg?
Okay, I was going to say that whole catchment area.
All three of them.
Right. So tell me about the experience. You said you want to make sure that the patients have a great experience.
Yes.
What does that consist of?
So when I say patient experience, is that they know that they're coming to the hospital because they're seeking health care. They're in a state of health needs. But again, they can go anywhere. Again, turn right and make it to Columbia, Charleston. They can go to Charleston to my sister hospital in Charleston, or Trident, or Roper, or they can go to Columbia to one of my sister hospitals there with the Midlands, or Prisma, or Lexington. But again, the goal is how can we ensure that when they walk in these doors, my catchphrase with all of our care team members is make the first impression the best impression. So that's how we keep them here when they come into our hospital.
I love that. The first impression, really, you only get one time to make that first impression. So we're going to take a break. When we come back, I want you to talk to our listeners about some of the changes that have been made. I think they'll be interested in learning more about that. We'll be right back. It's the People Station. Welcome back to the Health and Wellness Hour. We are chatting with the CEO of MUSC Health Orangeburg, Mr. Walter Bennett III. Now, Walter, before we went to break, you talked about the the perception of the hospital, and you're talking about changing the patient experience and what that looks like and what that means, not only for you and your staff, but for the consumer. What changes have you made for the broader audience to know? Because we still have some folks who are still hesitant about choosing MUSC Health Orangeburg as a viable option for their medical needs. Because it's not only just emergency care for the hospital, but you also have primary care, specialty care. We've done interviews with neurologists and your podiatrist. So again, thank you for offering that. But what changes have you made that folks would be interested in knowing about?
So what we're doing here, I call it for my team RISE. It's the acronym. So R is for rebranding. We've been going through the entire rebranding process from TRMC to now MUSC Health Orangeburg, and we have a whole campaign on It's a New Day. It's a new day when you're coming into our doors. We hope that you feel a new culture, a new environment when you're coming into our facility. I is for integration. We're integrating with MUSC because, of course, MUSC Health Orangeburg, formerly TRMC, has been part of the Orangeburg community for years. And now we're part of a broader healthcare system. So how do we integrate with the healthcare system at MUSC and understand that the resources that we have available to us that we can bring to the Orangeburg location? S being stabilization. We were kind of under some financial straits here in the hospital. So how do we stabilize our finances, but how do we stabilize when it comes to our quality indicators, our culture here, but also, again, we mentioned our patient experience. So how can we ensure that we're stabilizing that? And E, we're going to execute on what we need to do. So we're executing by ensuring that we're recruiting new physicians into the area. So just like you mentioned podiatry, we just recruited 2 new podiatrists here into our market, where we just hired another radiation oncology just 2 months ago. So again, spanning our radiation oncology healthcare services here. We just hired another medical oncologist that's coming on board next year.
What has been their incentives? How you getting it? What you doing?
What for me is actually selling the community. Orangeburg has a very tight-knit community, and they're all about community. They're not like I come from Spartanburg, and so I don't want to say anything bad about Spartanburg, but Spartanburg is a very nice community as well. But Orangeburg is different, and it brings back to like, wow, I really want to be a part of that, and that's what I'm selling to every single provider that's coming on board, that you can be a part of something of making an impact to a community that needs your types of services. So that's one of the selling points that I've been creating there. We're also looking at how do we engage with our leaders here on ways of becoming more accountable for the services that they offer. It is a business. So how do we run a business? Some people just didn't realize how they make the impact of running a business.
Healthcare is a business.
It is a business. So we're actually implementing new skills for them as leaders to ensure that they're running their business appropriately. So we're also looking at how do we bring more services to the area. One of the areas that we're going to bring to the and that we're going to announce, in which I'm going to give you a little sneak peek.
Do we get an exclusive?
Sickle cell is an area that impacts our community a lot here. So we hope to open up a sickle cell clinic here in Orangeburg early next year. So there's a lot going on here. So again, bringing those services close to home, because I want to keep our patients here close to home.
And we want them to be here. Thank you so much for your innovation. We're going to take a break, but when we come back, I want you to tell our listeners how they can get in contact and keep up with you and what's going on with the hospital, but also if they have some concerns, because, when you run a business, as you say, you're always going to have some level of concerns, but it's how you meet those concerns that really make a difference. Exactly. We'll be right back at the People Station. Welcome back, and thank you for sticking it out with us for the Health and Wellness Hour. We are still chatting with the new CEO of MUSC Health Orangeburg, Mr. Walter Bennett III. Before we went to break, Walter, you talked about selling the community. When you're getting these new providers and you're building out innovation, you're selling the community, my community, which I love because it's all about community. What is it folks can expect from MUSC Health Orangeburg?
So here at MUSC Health Orangeburg, we are trying to do anything that we can when it comes to innovation. One of the big things that we just implemented this past Thursday is our new electronic medical record system.
Oh,
It's called
wow.
Epic.
Okay, and that is epic.
It was an epic of a conversion for us, but it allows for us to have personalized care when it comes to the patient experience with medicine. So,
And talk about what that is and how that benefits the customers, the consumers.
So one great thing about Epic, it has great continuation of care, being that if you're seeing a primary care physician in, say, Branchville, if they had to visit the hospital, they know exactly what that patient was being seen for in Branchville, and they understand, okay, what was the continuation in care when they can, okay, your primary care physician was treating you for this, now I know how I should treat you from the emergency side standpoint. And if you get admitted to our inpatient floors, it's great continuation of care when it comes to talking with the emergency department and with the inpatient unit of the hospital. So, and the other piece of it is MyChart. MyChart allows for the patient to have some ownership in their own health care as well.
So it's a PHR, personal health record?
A personal health record for that patient as well. So with MyChart, they're able to see all their health records from when we went live with Epic also. It allows for them to see results whenever they have labs done or when they had x-rays taken. It allows for them to schedule the appointments with their physicians.
Let me speak to that too, because that's an excellent point. You know how like you would get testing done to see, you know, what's going on with your body. You may have to wait several days and in some cases weeks. I have MyChart, and MyChart, in some cases, you might know by the end of the day. Every situation is different, but within 24 hours, I have those results. And so timeliness, being able to manage conditions early on, you know, that's what y'all are doing here.
That's what we're
Health,
doing here. And in this, we didn't have that before. So with Epic, it allows for all of that here on site here. Another thing, we, I don't know if people are aware that we actually do robotic surgery here.
No.
Yes, we have a Da Vinci here, and it's a specialized
That's his name, Da Vinci?
Da Vinci.
Okay.
That allows for us to have robotic surgery from the general surgery standpoint, but also from the gynecology standpoint. So if you had to have, some women have to have hysterectomy, but you can have a hysterectomy utilizing a robot here, where it's less, I guess,
invasive.
It's less invasive. The
Recovery time
is quicker. So with all of that said, you can have the surgery one day, and then a couple of days later, you're not as I guess hurt, and your recovery is sped up a little bit quicker than that. So we're looking at how can we invest in the hospital a little bit more when it comes to innovation here. And then of course telemedicine is another innovation where you can just pick up the phone and you can see a physician through your phone or your computer. So that's another innovative way of creating access to care here at MUSC Health Orangeburg.
I love that, because people, you know, as a result of the pandemic, people are more apt to use their phone and to participate in telemedicine, and then with the third-party insurance reimbursing. So it's a win for everyone, and you're not leaving anyone out. You know, your catchment area is very rural, very geographic, and you have a lot more land than people, but those folks, you know, they're living in, you know, food deserts. They may be living in medical deserts. And so what you all are doing here, and what I think you're going to continue to do, is grow and broaden your spectrum. Now, for folks who want to reach out to the hospital to share their experiences, good, bad, or indifferent, what's that number, and how can they do that?
So one thing that I put in place once I got here is a new patient experience manager. She is amazing at her job, and she makes people feel at home when they're speaking with her.
Do you want to shout her out?
I want to give a shout out to Ms. Eval Pride. She is our patient experience manager. But if you have any questions, concerns about your experience, give her a call. The number is 803-395-2826.
Now say that number one more time.
803-395-2826.
Well, Mr. Walter Bennett III, it has been a pleasure having you today, and I just don't think it's going to be our last time. I know that
I will hope not.
you have been out in that community, and I'm sure people are going to see you out in the community because that's what it's about. If you could speak directly to our listeners and our viewers, what would you say to them in terms of, welcoming them with open arms?
Well, first of all, I want to thank the Orangeburg, Calhoun, and Bamberg County community for welcoming me to your community. I feel like I'm back at home. I did mention that I would say, a native, quasi-native of the area because I'm originally from Manning, South Carolina.
Okay,
So,
that's all right,
of course,
yeah.
this area was in my backyard, but now I do feel like I'm back at home in this community. So, but one thing I wanted to say to our community here is give MUSC Health Orangeburg a chance. We're making great strides, we're making great improvements here, and we're trying to give the first impression to be the best impression when you come here at MUSC Health Orangeburg.
Well, I have had an amazing impression so far, and I'm sure others will too. Thank you so much
Thank you
again
so much.
for being here, and thank you all so much for tuning in to the Health and Wellness Hour, brought to you by MUSC Health Orangeburg. Until next time, it's the People Station.